You know, we sometimes I think forget that we're all human. And when something so dramatic happens, it makes us remember that at the end of the day, these small things don't matter. The thing that really matters is, did you help somebody or did you not?
Times of crisis push us to innovate, to adapt and evolve. To truly come together, we must break down barriers and nurture alternate perspectives. Science and technology offer the opportunity to fuel discovery and magnify our ingenuity. These are some of the stories and people whose ideas are carrying us forward to emerge resilient.
So it was literally probably overnight that we went from, is this real, to, oh my God, this is real and it's way worse.
I remember I sent an email to my team saying, hey, I think we should work from home from now on until this is clear, because it's just the tip of the iceberg.
I am an optimist. I don't know if I've ever had my optimism shaken so hard, to be honest.
Early on in the pandemic, it became clear that COVID was going to be a battle fought on multiple fronts. We first needed to understand the virus and how it was spreading. But we also understood, as a result of the increasing disruption to our lives, that there were going to be inherent societal consequences.
It's a respiratory issue, it's a respiratory crisis, but yeah, I think the psychological aftermath will also be quite something.
And that has a social cost.
But I felt like I had to learn, I had to get educated. I felt like I was in the privileged position to do something.
So we asked ourselves, without any solutions in front of us, how do we take action to fight the virus? And how do we begin to understand the impact of the pandemic on a personal and on a community level?
It became clear that something was happening that made my expertise really, really relevant in a way it had not been before.
And then immediately, of course, your engineering mind goes to, okay, how can we fix this? How can we help?
I tend to think about, how do people understand communication technologies? How do they incorporate them into their lives? What are the consequences of that? And that interplay back and forth, where technologies are helping define who we are and how we live, and the way that we understand technologies is helping define what those technologies become and how they develop.
We're unique, but we're absolutely this entwined web of ways of being in the world. So most of what we have to learn is how to study relationships.
I think that everything that happened last year is very hard to understand in terms of a technology-people relationship, because we were all traumatized and living through a completely surreal experience, losing our sense of what is reality.
Like, the lesson of the social sciences is you can interject one thing, time, and it changes everything.
The purpose of the Work Trends Index is to take the pulse of the global workforce and understand, how is modern work changing worldwide. There was a survey of about 300,000 workers in 19 different countries, trying to understand their experience of this change. People report more meetings, more hours at work, more messaging. They report more messages after hours, and telemetrics show that there is more messages after hours. So there's just this continuous staring at screens, typing into screens, reading on screens, listening to screens, being with screens. In a hybrid environment, the danger is that a lot of social capital is built through informal and spontaneous sorts of interactions. If you're not in the room, you're part of all the scheduled conversations, but you're not part of any of the befores, and you're not part of any of the afters. And a lot of the occasions when those work relations develop a bit of a flavor of care for one another are harder for you to access. We keep talking about, when we're talking about the new future of work, we're saying we don't want to go back to normal. We want to build a better future. We want a new, better work.
Everything in our lives, how we work, play, and learn had to change overnight. We are naturally social beings, and so even the idea of social distancing comes with an inherent cost.
The other thing about people at home working all the time, especially if they're living alone, is that's kind of a lonesome place to be. Struggling to feel connected with their jobs, struggling to fit into their organizations if they've been hired recently, feeling much more dissatisfied in general. So every time everybody's like, well, you know, working from home is like this. I'm like, are we talking about working from home? Or are we talking about working from home during a pandemic? Because they're completely different matters.
We had that privilege to be able to sit in our homes while people who didn't have that same privilege risked their lives. I mean, there was frontline workers across the board. We oftentimes just think of medical workers, but what about the people who worked in the grocery stores? What about the people who were delivering our packages? I mean, these are frontline workers who kept society going.
There's often this incredible amount of pressure for them to provide. And then once they've met that demand, we forget about them. We're going to have to come up with economic models that value not just that one person who steps up, but many people being available at that moment. How did we make it through this? You know, the people who kept caring for others, that's how we made it through.
We were searching for any cure, for anything that could help, and nothing was on the horizon. So here comes this 100-year-old therapy that we have used in the Spanish flu pandemic, right? Multiple organizations came together to initially leverage convalescent plasma for potential treatment for COVID. What I've seen in terms of people connecting with each other because of the disease has been extremely powerful, especially when they were able to save or help another person and save their life. And there were, of course, cases where people were recovering if they got the plasma at the right time, in the right dosage. But to learn that those precise conditions, you have to go through very rigorous medical studies. And we had limited amount of time, and the studies were conducted under different circumstances. So the data was coming in from all different areas, and scientists were sitting literally in the room together discussing, what does that actually mean? We actually invited these community leaders to participate in the very same forum with doctors, with scientists, with medical institutions. It was helpful for these therapies, but it was also helpful for other therapies that were emerging because the same scientists were working on a lot of these same things, right? And now they were talking, they were discussing, they were connecting. Now you have 2 heads, 10 heads, 20 heads better than one. So it was completely unprecedented in terms of how survivors and community leaders connected directly with those who were making medicine, who were making vaccines, who were treating them, and helping them understand what is happening out there on the ground.
The stark statistics on who was dying versus who was living based on socioeconomic situation, that will frame a long-term and powerful discussion about our society and disparity.
3 times the number of people of color were killed by the virus than represents their demographic in our population in the United States. That should make no sense. There's not a biological reason that happened.
Problem is that this pandemic has exposed so many disparities. We have to create a more equitable world going forward. I just don't see any way that it stands the way it is.
I came here mostly because I could see that the people who wanted to build out the social sciences understood, at least in some sense, that computer science engineering was increasingly in the thick of social questions. March 5th, this doctor who was involved in Greenlight Ready texted me, and he said, I think we have a workflow problem for taking care of marginalized groups experiencing COVID. His thought was, if you equip communities, in fact, they're going to be able to care for each other more effectively. You'd need to model how people coordinated to see what kinds of resources were people asking for that are then proxies for how sick are they. And from that, be able to hold these events where people can get relief. Now we're doing vaccine expos with mostly Black and brown communities, Latinx communities particularly, undocumented workers, who do not want to go to any public hospital. That means they can go to community organizations familiar to them and in a confidential way seek help with people they trust. Having hubs, having strong spokes that are anchors and are going to bring the domain expertise of communities to the conversation. It's not a top-down, I'm going to inform people what they should know. It's going to be this amazing opportunity to say, oh, I'm not the subject matter expert in what's going on in this setting. What do you know that I don't know so that I can advance the state of the art? Greenlight Ready has gotten doses of vaccine in the arms of people who otherwise never would have walked into a public hospital. That's huge. This effort is, what does it look like to build a toolkit for the rest of the world to be able to manage their health?
Our power is to change the world through science, but our responsibility is to understand and empathize and envision the world that we actually want to be a part of.
Technologies are always opening up this possibility of connecting us, whether it's for work or for understanding each other. And at the same time, it's necessary, not sufficient.
When we think that technologies are going to offer the solutions and therefore we don't have to worry about the social part, it allows us to not really confront those problems.
The pandemic perhaps made it a little bit easier for people to see they needed to, if they were building something, tune into who they were building it for and why. Was it some intuition about what somebody else needed, or did they ask? Did they listen?
The pandemic has created space for critical conversations. A truly equitable approach to a healthier society will mean more than just reinforcing our health systems. It will start with our social systems, our communities. Now it's about finding the balance between preserving and reimagining our social fabric as we work to reopen.
I want to look back at this moment and say, this is when we started building out public health care from the ground up. That we literally said, oh, communities, that's where care happens.
I think that for me, a big silver lining of this has been people came through for each other. They started mutual aid networks. They cared for one another. Workers covered for each other. We gave each other grace. And I just hope that we can continue to do that going forward.
And as humans, we just think about a lifetime. Oftentimes we think about a couple of years, maybe a decade. But, you know, there's a beautiful proverb. We don't inherit the earth from our parents. We borrow it from our children. So that is our responsibility at the end of the day.
This is our wake-up call. This is literally our chance to say, okay, 21st century, how do we want to do this?